Right, healthcare workers on the domestic arena, like their counterparts elsewhere, are selflessly working to respond to the latest resurgence. And for more on their efforts, I have Kim Yeon-SEUNG here in the studio. Yeon-SEUNG, welcome back.
Happy to be here, Sunny.
Right, so how is Korea's healthcare system coping with the surge in caseload?
Right, so Sunny, gradual easing of COVID-19 restrictions started less than 50 days ago, and since then, the number of critical cases in the nation has tripled. And the entire medical sector is really feeling the strain due to the growing figure. Close to 88% of ICU beds in the capital region are still full, while 80% of beds are occupied nationwide. But this bed crunch isn't just affecting COVID-19 patients. In Gyeonggi-do province, for example, a pregnant woman was forced to give birth in an ambulance because there were no beds left in all of the 16 hospitals nearby. Seoul National University is also pushing back non-emergency operations. So to help out the overburdened medical sector, health authorities have created an on-site COVID-19 task force.
The task force, gathered from the Health Ministry and the Ministry of the Interior and Safety, will constantly check the status of ICU beds, find additional local treatment centers, and support outpatient treatment centers nationwide.
Right. Meanwhile, Yeon-SEUNG, I understand a cluster infection in the country's central region is fueling much concern. Tell us more.
Exactly. So one of the most worrisome cluster outbreaks has been a cluster infection at a correctional facility in Chungcheongnam-do province. A total of 57 cases have been confirmed so far, including 54 inmates and 3 staff. The nation already experienced large prison outbreaks last year, with more than 1,000 inmates and staff being infected because of the highly dense and poorly ventilated conditions at these facilities. So this time, health authorities are really focusing on taking control of the spread before it escalates into a recurring nightmare. On this Monday, a 4th round of COVID-19 testing at the prison will be conducted to comb out more infections if there are any. There has also been a string of infections linked to a church in Incheon and its missionary team, now reporting at least 85 infections.
Right, and also on this Monday, Yeon-SEUNG, I understand there's been a shift in policy within the academic arena amid the latest resurgence, right?
Exactly. So schools have also been beds of recent outbreaks, and in response, schools in the capital area are reverting back to remote learning. This comes only 4 weeks after they fully resumed in-person learning. So first and second grade elementary schoolers can attend school every day, but there is a 3/4 attendance cap for 3rd to 6th graders. For middle and high schoolers, classrooms will be limited to 2/3 of their full capacity. But outside Greater Seoul, each region has the authority to decide on their own measures. The cities of Daegu and Gwangju, for example, will stick to in-person learning.
Right, I see. And finally, what is the latest on the Omicron front here in the local front?
Well, so far on Monday, the nation has confirmed 178 Omicron cases, and 4 of these cases turned out to be breakthrough cases among those who had received their booster shots. 2 of the infected had received Johnson & Johnson jabs, while 1 received 2 AstraZeneca doses and a Pfizer booster, and the last had 3 shots of Pfizer's vaccine. All 4 of these cases are reported to be mild symptoms. Although experts say that even booster shots cannot guarantee protection from an Omicron infection, they significantly bring down the likelihood of serious illnesses and deaths.
All right, Yeon-SEUNG, thank you for now. Do stay with us for the extended talk.